on today's episode of Let's Get Growing with Vyne Dental Podcast. I'm so excited to be here. My name is Cissy Mangrum. I am the co-founder and chief revenue officer of RevTech Partners and Maximize RCM Consulting. I have a little over 30 years of experience. I know, I look young, of healthcare and dental and operations and clinical and revenue cycle. And I absolutely love what I do. And I am so excited to be here on Vyne Dental's podcast so that you can get to know me and hopefully I can get to know you soon. What has inspired you to pursue a career in dentistry and what keeps you passionate about today? Well, let's be honest. I started my career in healthcare. I did 25 years in healthcare, and I had an opportunity to work at a dental DSO, and I honestly thought, this is amazing. It's going to be so easy. It's going to be so much fun. And because I came from orthopedics and we had lots and lots of codes and rules and dental regulations. I mean, not dental, but orthopedic regulations. And I thought coming into dental is going to be amazing. And then when I came into dental, I was like, oh my goodness, this is where I need to be, because I realized that it was like doing deja vu. I started in healthcare about the time that medical practices and hospitals were starting their MSOs and doctors were joining hospitals and the EMR was coming out and all of these different things. Insurances were, there was tons of insurances, and then it came down to, the main insurances. And so it felt like I've entered back into that world. And so I was so excited to join the dentistry world because I get to bring the knowledge that I grew up in healthcare to dentistry and hopefully make it a little easier as we transition to better processes and better things from a rev cycle and operational standpoint. So that's what really kind of brought me into dentistry, was that it just needs a little tender loving care, and I'm super excited about it. And so I'm very excited to be growing with it and doing this with you. The second question here, it says, can you share a memorable patient success story that showcased the impacts of modern dental technologies on patient care? From a patient perspective, one of the things that I have seen be the most impactful is patient financing. Dental is not inexpensive. It's so super important for our health. And sometimes people just don't have the discretionary funds to go and, get dentistry. And I will tell you a personal story. I didn't go to the dentist when I was younger. I'll be honest, I rarely go now. I try to get my every 6 months when I go, but when I was younger and a young adult, one of the things that held me back from going to the dentist was the discretionary funds. I didn't have the money to go and get my teeth cleaned every 6 months. And I was always afraid that if I went to go get my teeth cleaned, they would find something and then I would have to pay for that. And so there wasn't really patient financing back then. I mean, you could do in-house financing with a practice, but there wasn't that. And so I have seen more people be excited about patient financing, and getting their dental needs done is pretty awesome. And I think every dental office should have that. Now, that being said, I don't work for a financing company, but I can see the value in it. And that is something that I think is super important. And so it's very successful for patients. So I say, hey, if you got patient financing, put it on your website. Patients want that. And in today's time, oh my gosh, if you go to the website and it says, hey, you can get pre-approved for some financing, before you go, then they're already okay with going to the doctor and they know they're going to be able to pay for it. So super important, super exciting. I've seen some amazing stories and some amazing people get treatment because they were able to get their patient financing. So that's one of the success stories I have seen in the dental world, and it's super impactful. Question 3, it says, in your opinion, what emergent dental technology or trends excites you the most for the future of dentistry, and why? Well, everybody talks about it, but I'm telling you, it's AI. I'm telling you, it's technology. It's these platforms that are coming out, and especially the platform that I am working with and building. Oh my gosh, I can't tell you how exciting it is to see things come together that has, for me, been in my brain for years, and saying, why can't this happen? And now working with industry experts and people who understand AI, understand all the machine learning, and there are just so many acronyms that come with this. That is now taking the things that I've always wished as a rev cycle leader and making it happen. And so I think we are going to see some amazing trends when it comes to efficiencies. Things that we're doing on a repetitive basis. I can think of stuff like verification of benefits, right? This is a repetitive thing and it takes so much time, and it's not revenue generating, but it's revenue supporting, and it's vital. But it's one of those things, I think, why are we humans doing this when AI, technology, robots, bots, RPAs, all that stuff could be doing it for us? And there are some great companies out there that are doing that and starting to see that. And I tell people, yes, it's not hard. Yes, it's hard to get technology going. Yes, it's hard to adopt that technology. But boy, oh boy, when you do, holy cow, it's amazing. It's amazing, the efficiencies that come from those new technologies. So super excited about seeing those mundane tasks go away, and watching the trends of better costs and better things coming in the practices. So the fourth question I have here is, how do you approach educating and empowering dental office to take control of their health outside of the clinic for a work-life balance? Okay, so for me personally, I think it's extremely important that you don't overwork yourself. A lot of type A people, dentists, anybody that's in there that's trying to just get stuff done and you get really excited, you can burn out. And you don't even realize you've burnt out until after it has happened. And so what I tell people, and who have ever worked for me, is that, listen, you got to take your time off. That is part of your compensation package. I don't know if you guys have heard that, but when somebody negotiates to go to work for you and they say you have 2 weeks or 4 weeks or 6 weeks of vacation and PTO, that's part of your compensation. So it's important for you to go and take it. And here's the important part of doing that. When you go away from your job, it takes 2 days to get that out of your brain and start to relax. Okay. If you're gone for just 5 days, 2 days, you're still thinking about work. The third day, you're starting to feel pretty good about it. And then the fourth day, you start thinking about work again. And the fifth day, you're preparing and looking at emails again. So you just have to get away and say, I'm not going to do it. And so one of the things I tell people all the time, you go on vacation, go on vacation. Turn your computer off. Don't take it unless you just absolutely have to. Take your apps off your phone and disconnect. Promise you the clinic is still going to be there. Promise you they're still going to want you to come back. So take that time, because when you can do that, you'll reset your brain and you won't burn out. So it's super important. And take your lunches. Oh my God, take lunches. I know a lot of dental offices work through lunch and they go, let's just see patients. Take your 30 minutes, take your hour, go outside, get away from the office for just that little bit of time. Telling you what, makes a big difference in the whole thing. And then question 5, if you could give one piece of advice to a fellow dentist or professional to grow their practice, what would it be? So I'm going to tell you, this is what I would this is what I tell everyone. Just get your data at the beginning. You hear all the people that are doing scheduling and they're saying, oh, just get them on the schedule. Just get them on the schedule and we'll get the information later. Take the 5 minutes or the 8 minutes, whatever it is, for every new patient you have. Spend time with them, get the information, make sure it's correct, because you know what? That is the point of where most the mistakes happen in the rev cycle. That is where you start to lose your money, because if you don't have all the correct information, you don't have the insurance information to get the verification of benefits, you don't have all the information when the patient comes in, and so it takes more time, and now you're wasting time from a chair side. And then the doctors get frustrated and the clinic gets frustrated because now we're behind on trying to get information. Take the minutes and get it at scheduling. You know what? They're used to doing that. Patients are used to giving their information. So just go ahead and do that. And use the technology to have the patient check themselves in. If you don't have that, I think you should do it. That right there is going to make your practice grow. They can schedule online, they can check in online, and they can verify all their information online before they even show up in your practice. Do that, and I promise you, you're going to see your practice grow, because you're going to have more people coming to your practices. You're going to fill up your chairs, and you're going to be able to have an effective operational process. And patients are a lot more, they're a lot more apt to come to a practice that's using technology than they are to come to a practice that is sending paperwork to them or making them fill out paperwork online or filling out paperwork in the office. So the one piece of advice I would tell you is engage in those technologies that allow you to do online scheduling, allow you to take all the information, if you're doing it via phone, from the patient and get it into the system so it can automate, and then take that technology of checking in and verifying and paying their balances before they even show up in the practice for their appointment. And so those are the 5 questions. Super excited to have been on this podcast. I just want to tell you a little bit about what I do. I and a few of my partners have started a company called RevTech Partners, to which we provide technology solutions, a holistic revenue cycle platform that works with your processes, and also going to be working with other technologies to help streamline your rev cycle processes. One of the biggest things that we're doing right now is a rules engine, and we are also doing coding, automated coding, to help capture as much of the revenue as possible in the practice, and also denial management, which we're super excited about. And then the second thing that we do that I'm very passionate about is maximize RCM consulting, to which we come in and we help support all of our rev cycle teams in the practices, help them meet their goals, and help them grow. And so that is what we're doing. I will have a link to my website as well as to my LinkedIn. Love to have you guys connect with me on LinkedIn. I have a group that's called Optimize RCM that you can join me on there, that we talk all things for RCM. And I also have a newsletter that I put out all on LinkedIn. So would love to have you connect with me there. And I appreciate you, Vyne Dental, for allowing me to be on your Let's Grow podcast. I hope that you guys got something out of this, and thank you so much.